everyone. Good afternoon. Hope you all could catch some coffee. I know it's much needed after a long day of sessions and lunch and then, more sessions. So the topic we are talking about in this session is, surprise, surprise, AI. This will be a very healthcare-focused discussion. And while we have listened to some brilliant speakers, visionaries, heard the vision of what AI is doing and can do in multiple different verticals, industries. We also saw some products and some launches. Before we get into AI in healthcare, want to kind of make sure we all ground ourselves in the reality of healthcare. Now, the vision is big, as is anything to do with healthcare, given how big it is in terms of total value, given how big it is in terms of value to us personally too, because it impacts all of us very, very closely. So it's a very high stakes game and high stakes industry. Having said that though, while the potential is there to completely transform healthcare, to enable better health, make us live forever, reduce cost of care, improve patient access, and revolutionize healthcare in ways that we have not even thought of. But having said that, healthcare has its own process. And I want to start with eliciting some inputs from the esteemed panel around why healthcare is so unique. But before I do that, I do want to introduce my esteemed panelists here. So starting with the extreme left, Raj Kadam. He's a CIO at Liberty Dental, and he has played leading IT roles in other health organizations before that. Dhanusha is a senior director technology at LA Care, and she was at Elevance Health before this role. Luke Rockenbach, my good friend, we've been working together on several initiatives for the last 6+ years. He represents the only provider on the panel, so he's a regional CFO at Providence Health. And then Anand Nair, he represents the service provider and the technology side. So as you can see, it's a very, very rounded panel, and hopefully we'll have some good discussion and draw some great insights. So before we get into the potential of Gen AI and what's happening in healthcare, would like you to educate all of us in the audience about what's unique about healthcare, which makes the implementation and deployment of AI a little bit different than in many other industries. And Raj, if maybe you can kick us off.
Of course, when it comes to healthcare, HIPAA and security around the patient data makes a huge difference. So where do you store your data has a huge impact or has a huge play into what kind of technology you would use or where you would store that data, whether it's in the cloud or whether it's on-prem. And given the advent of Gen AI, what aspects or what work streams would you flow that data into? So that has a pretty big bearing on just using AI on the healthcare side. So I would say the data aspect is pretty crucial, and we have seen a majority of cybersecurity attacks have been on healthcare, Change Healthcare being one big one that has been a recent, which had a huge impact on the healthcare industry. So considering all those facts, data is, I would say that is the most crucial part that we have to take care of before implementing any AI aspect in healthcare.
So Luke, you look at it from the business aspect, right? You're managing a region right now, and before that you were leading large scale transformations at Providence. Any additional perspective on the uniqueness there?
Yeah, absolutely. I think you're right on with the data security and the HIPAA considerations. Healthcare spans many different activities, from actually taking care of patients to the billing function to on and on and on. And where you deploy technology, AI or machine learning or whatever, I think you have to really be thinking about the ethics of it. Is it the right ethical technology to deploy? And you have to be very thoughtful about the training that our clinicians, our doctors, our mid-level providers, our nurses, and all the folks that are involved in the care delivery, you have to think about the training that they've had. And in some of these new technologies, we are enabling the clinicians to do better, faster, more effective, more accurate, more consistent work, but it's done in a way that they weren't necessarily trained. And I think the integration of that is critical to get the right success, to get the right results that you're looking for.
So you brought up a good point around the number of constituents or roles that need to get together and really agree on adoption for it to become real. And again, adoption becomes a challenge because of the stakes involved. In healthcare, you don't get second chances. So if the AI hallucinates, you get a result which was not accurate, and an action is taken based on that, the results can be catastrophic, right? How do you overcome that trust deficit or that professional skepticism, if you may, with a doctor kind of taking an assist from AI and then maybe refining their own diagnosis or treatment plan?
Yeah, I can think of an example that we've deployed. Really, anytime we deploy something new, it is about incremental testing and change and getting buy-in from all the key stakeholders. I'm going to take you back 15 years to a project I did that was not AI. It was an Excel project, but it was about OR optimization. How do we reduce the amount of time the OR is unused? How do we kind of do scheduling better? And that really took months and months to get the buy-in on just some really simple data points. Now today in 2024, we've deployed some AI technology that is across the organization helping us identify specifically how long we think a particular surgeon will take in a particular case, what the turnover time will be, so we can stack the cases more effectively. There's also a component in this where we need the physicians to buy in, to agree to adjusting their block time. Maybe we say, hey, you usually take 45 minutes for this case, not an hour and 15. Can we shorten the time? And it requires some of that negotiation, that testing. And that's not a clinical decision. This is just workflow. Right. So it's those kinds of things where you gotta start it with one doc or one team and just and get enough at-bats to prove it, and then allow them to be your champions. That's what's worked for me anyways.
Fantastic. So now that we got the challenge out of the way, I want to really now talk about what are we seeing actually happen, right? So of course we'll spend some time later on the vision and the future, but to make it real, right? When we talk about implementations or what's in the works, right? Would like to kind of hear some of those real life examples and stories from your day-to-day roles. So Dhanusha, why don't you kick us off with?
Absolutely.
I
think the energy level of this room is low, so I just want to add something, right? I know when you introduced me, you said I'm a Senior Director of Technology at LAK Health Plan, but there's one more thing that I want to share. I'm a mom of 2 kids who use generative AI every day. They use ChatGPT to do their homework, and they've figured out not to get caught by school. So AI is everywhere, Gen AI, machine learning, NPI. But as far as real life examples of, applying AI, I had a very recent experience. Last month, I went for my annual mammogram. I mean, women who are over 40, they know they need to get their annual mammograms done to screen for breast cancer. So I went to the office. They gave me a booklet, and opened it, and it said, "We're using machine learning AI to help you with, to confirm your results." So that was really intriguing, and I went through it. So what they're doing is they're actually incorporating AI in mammography. So instead of just a radiologist looking at the images and telling you have breast cancer or not, We have AI now playing the role of a second pair of eyes to look at the images and tell, to actually help assist the radiologist. So I found that really interesting, because that's the real, I would say it's a good use case where you're not really completely leaving it into the hands of AI to diagnose a disease or diagnose a health condition. We are actually augmenting human mind, the clinical experience of the radiologist with AI to make sure if there's something that the radiologist has missed, it's caught by AI. So that's a real life example of where healthcare, AI can play a key role, or can actually augment what humans are doing today in the healthcare field, like doctors and physicians and radiologists and technicians. So I think making sure your diagnosis is accurate and removing the burden off of humans completely and not completely, partially, and also eliminating the quotient of human error. That's where I think AI would play a key role. Again, not leaving it completely into the hands of a robot or computer, but still need to have human control over what AI is doing.
Yeah, so it's AI assist, but still the human is the one
that's
taking
where
the
I
decision.
see AI adding real value.
So for us, we had 2 successful implementations with Gen AI. Obviously, you can call it traditional AI or ML. We had the fraud, waste, abuse kind of implementations. With Gen AI, one use case that we successfully implemented was with our call center. Simple use cases like people calling in for status of their claims, for benefit inquiries. We have conversational AI now in 3 languages, and so far we have been able to contain calls at 15%. And the goal is, there are more phases and more use cases we are adding to it. The goal is to get to, say, 35–40% containment, right? That the conversational AI happens. And we also did a survey with certain age groups, and we found that age groups 65 plus rather deal with a conversational AI more than a human being, because humans tend to obviously get frustrated when it comes to at the end of the shift or things like that. AI still gives you the information that is needed. The second use case that we implemented, which relates more towards the care, is for any healthcare payer, we have to do care management. So, and traditionally the care management used to be done is people used to be put into cohorts and then managed as a group. So if you have multiple conditions like diabetes and heart condition, you are put in a group and the same kind of care is given to that group. Now with Gen AI, it has become possible to do personalized care, right? Including if genetic sequence data is available, use that data as well to find everything, then your family history, as well as all those lengthy doctor notes that come from an EMR, has helped us nail down exactly what are the barriers to care for that particular person, what are the interventions that need to happen that cater towards that person. So a very personalized approach. So our care managers used to take about an hour to 90 minutes to create a care plan. Now with help of Gen AI, it gets created right away and they just take 5 minutes to review it. So talking about human in the loop, so the care managers only take 5 minutes to review it, and the care plan is way more accurate than what a human could do in the past.
And that's fantastic, and real tangible impact there. Luke, you've been, in your previous role and this one, again, you've been trying, testing, evaluating a lot of AI solutions and use cases. Would you share some insights on what you found real and deployable versus maybe not?
Yeah, sure. Our opening speaker this morning, as well as Kevin, mentioned Microsoft and Nuance and some of the work that they're doing. We deployed a few of their tools in partnership. We're developing both in our clinical documentation space as well as in the ambient noise capture. And I'd love to share some of our experience about the ambient noise capture. The business case for this is reimbursement is going down, doctors are having to take on more and more of the administrative responsibility, therefore they can see fewer patients in a day, therefore they make less money, and it's just like it's a grind.
Right.
So the technology for this ambient noise capture, the promise is the doctor can actually engage with the patient. They can look them in the eye. They're not staring at a computer monitor to chart while they're doing their exam. And then at the end of the exam, the tool is suggesting, like you said, suggesting what the chart notes could be. The doctor edits and submits that. There's a few results that happen because of this. The first one is that the providers got more efficient. They could see more patients during the day, but their burden of administrative work went down also, so their satisfaction goes up. But I think the coolest part about the implementation of this tool is we have doctors looking patients in the eye now versus looking at an Epic screen, and I think that's a phenomenal patient satisfaction improvement, and I have to believe that's going to improve healthcare overall. So the more of those kinds of things that we can deploy to augment and enable our clinicians, I think the better we are. And we had to do the same thing from an implementation standpoint that I mentioned earlier. It was like a group of like 12 docs that volunteered, and then they tried it for a while, and they became the champions, and we expanded it more and more throughout the organization. That's one that we're really excited about and proud of.
So have you seen physician utilization go up in terms of number of patients they can talk to in a day versus doing the admin stuff?
Absolutely. When physicians are burdened with all the administrative work, the post-visit charting, the billing questions, all these kinds of things that add to it, maybe they're a regular primary care doctor or a general medicine provider is seeing maybe 15 patients a day and they're burning out, where the reimbursement to make their traditional compensation would be probably closer to 20, 25 patients a day. So this allows them to kind of to get there and do medicine, which is what they've trained for, what they should be doing.
Right. So Anand, in your role, right, at UST, you speak with a lot of clients who are either looking to fulfill a business objective or are just trying to find out how AI can help. Any war stories you have to share?
Yeah, sure. So UST currently work with over 55 payers, some of them regional players, some of them mid-size, some of them large, and 40 provider systems. So one common theme that we heard, everybody is approaching AI with caution, but everybody want to leverage it. One of the main things that they're worried about is public perception, right? Is AI used to deliver care or deny care, if it's from a payer perspective, right? And if it's from a provider perspective, I believe the most important thing is, again, from the public perception standpoint, is building trust that we talked about. Is again, it's going to be transparency. So we don't want to put out a human-like interface to make the patient feel that you're talking to a human, right? So if you're talking to an AI, so make it transparent so that the trust can be built. So one place where I see getting a lot of traction is Raj, that you mentioned about care management area, where sometimes, like Raj was talking about charts, sometimes the charts are thousands of pages long for people with a lot of comorbidities and multiple conditions, where it takes a long time for the care coordinators or the doctors to go through it. But why can't we use an AI to summarize it and then focus on the relevant things, right? And another opportunity is personalization. So that is again another area where, in multiple ways. One is when you go to the doctor, you get a standard set of questions they read from the screen. I think that Luke, you are mentioning about. But what about going through all their prior charts, looking at the pattern, and then ask questions that are personalized, so that they can focus more on working on the wellness of that person, right? When we go for the annual visit, than focusing on treating illness, and how do we elevate that experience for a patient. So that is, and also there is a lot of opportunity being explored on the IT productivity improvement. I think there were a couple of people talking about that. How do we fast track the SDLC so that whatever projects we used to do in 9 months can be done in 6 months? So those are low-hanging fruits that's being explored. And in customer service area is another place where some of the large payers that we work with, they have multiple backend systems. Sometimes customer service agent needs to get the questions from a member calling in, and they have to log in and gather information from multiple systems before they can answer. So again, generative AI can be used to listen to the call and then give the answers to the customer service agent, which will help them answer the questions faster, rather than putting the customer on hold. So those are some of the use cases we are seeing getting a lot of traction.
So, coming to the use cases, right? How do you select what use cases to go after? And I'm asking that question because in many other industries, you have these large language models which have been trained on public data, and you already see the efficacy, and then you kind of try to adopt it to your enterprise, use enterprise data to kind of train them and kind of get going. In healthcare, that doesn't exist because there is hardly any public data, right? So how do you select what use cases to go after? Is it based on anecdotal evidence from other peers saying, hey, this worked for me, maybe this will work for you? Or is it more to do with business objectives, saying, here are my top 10 priorities, let me figure out if Gen AI can work?
So for us, it was, we documented all our business processes, and believe it or not, it was with help of Avasant we did that back in the day. And once those processes were documented, we found out, okay, where are the low-hanging fruit opportunities, first for automation, just like RPA or something like that. And then coming into the more manual aspect where people are spending more of their time in generating content, right? In the sense of, say, a call center or care management. And we saw that could be accomplished by generative AI, right? And that is how we tackled it, and we nailed down on 2 use cases that could help us generating that. That was our process, in the sense, documenting all the processes, and then step by step looking at it and seeing where can Gen AI be applied.
So in that sense then, and Luke, since you are the money guy, does funding become an issue? Because you don't have these large technology firms spending those R&D dollars. You are probably having to do some of that internal development and testing, even grounds up training those LLMs.
Yeah, I think like you've described, we also look at our business processes. I'd love to sit here and say that we're investing hundreds of millions of dollars into scouring the communities and population and trying to find who's going to have the next heart attack so we can intervene with them now versus 6 months from now. And I think some of the payers are doing some of that work with their members, and I think some of the data consortiums are doing some of that. But our focus and our kind of needs right now are to reduce the overall cost of healthcare. And there's a lot of administrative burden. So looking at all of our processes and then asking ourselves, what is the right tool? Is it offshore? Is it outsource? Is it automation? Is it machine learning? Is it AI? Is it an Excel spreadsheet? Is it a scalpel? Whatever the right tool is. And then once we have that kind of that mental model, then we go after the tool. Fortunately, we've had some really visionary leaders at Providence that have locked arms with companies like Nuance and Microsoft that have helped us as generative AI has become more in the mainstream in the last year. We've invested in like an ethics council around it, as well as some kind of intentional projects kind of across the spectrum. Everything from helping with the chat when folks call our contact center to improving the patient care, like I said.
So I want to add one point, and if you look at how do you fund it, that was your question, right?
Yep.
Last year, the heat wave actually came almost a month earlier than predicted, earlier than normal, and that has resulted in a lot of ER visits due to heat stroke, right? And the cost for payers was over $1 billion just for that one day of heat wave, right? And an average ER visit will cost around $25K, but installing an air conditioning unit on an average will cost $8,000, right? And so now we have technology and data available to find those vulnerable people. So the data that payers has alone will not help it. So we need to use the SDOH data that is available. Then there is a lot of data being collected by community-based organizations. And once we enrich the data that payer has with those two data sets, we can actually identify people who are the most vulnerable, who can possibly end up in an ER, right? Then another, considering the cost savings, as I said, over $1 billion that all the payers have spent together, that itself will make a business case to look at how do we either mobilize the community-based organizations to get them to a place where there is air conditioning, or even pay them to have an air conditioning in their house.
Along
That's
the same
innovative.
lines, I have a thought to share too. So my firm actually, LA Health Plan serves the most vulnerable population of LA County, low-income residents, certain communities of LA County. So we're a publicly funded entity. So what we really strive to do is to reduce our admin cost, cost of administering health insurance, and providing healthcare to the vulnerable population. So there are various areas where, and again, going back to what Luke and Raj shared, we do look at our business processes. Where do we have the most admin cost, right, as a company, and then focus on those areas. And one area where I know for sure we have a high spend is utilization management. It's as prior authorizations. I know the folks who are non-healthcare or who don't have healthcare background, there are requests for approvals from the provider before providing a service. Like, for example, if you're going into surgery, you need to get your health plan to approve it, authorize it, so you can go forward. So there's a lot of documentation that comes in, faxes that come in from providers. What I've learned is the providers, they tend to just take a paper form that they printed out years ago. They would have it in their drawer. They just take it out, write it in, fax it in. Even though we've tried to push our providers to go for, we encourage our providers to use digital methods, like file the authorizations online. But still a large amount of authorizations that come in through faxes. So those come in, and then we have to manually look at those. Or we do have OCR, but not that it's not that effective. So we're looking at machine learning and some other AI tools that we can incorporate to scan those images, the faxes, and convert or kind of pull the data out of there and create cases for our utilization management nurses to work on. So it's really based on your admin cost and where you're actually spending a lot of time and effort manually, and then try to use some of these newer technologies to help us to alleviate the problem.
Fantastic. Wanted to touch upon, and we are kind of coming to the last 5-6 minutes. Wanted to kind of touch upon the aspect of governing these AI initiatives and the kinds of structures that you might need to create internally. I would imagine, as opposed to other implementation projects, when you are trying to build AI, especially internally within healthcare, you may not succeed. Each use case may not succeed. Are you seeing the need to kind of come up with new structures within the organizations, new KPIs, new governance models, or does the traditional AI, well, I wouldn't say traditional, but does the normal IT organization, is that structure, does that still work?
The IT structure does work, and you still have the same SDLC, but the SDLC changes quite a bit in the sense that it is left and right heavy. And when I say that left and right heavy, is on the left hand side you have your design and architecture that has to be firm, so that takes more time, in the sense that, do you want to create the prompts that go into an LLM? Do you want an LLM to generate those prompts based on that data? Then that feeds into another LLM, right? Or to avoid the problem of hallucination, do you want to have multiple LLMs and then take output from all of them and see what is the consensus and take the best out of it, right? So how you architect it is the most important thing. So it's left heavy. In the middle, it's light because then you have the workflows and anything that you built, and development is light. And on the right is again heavy because the QA process, for us, it took a lot of time. So 50% of our SDLC was taken over by quality assurance because obviously, first and foremost, building the trust with our user base. So our users, our care managers, care nurses who are testing this. So building that trust took a lot amount of time, and making sure that aspect of hallucination is kept to a minimal. And based on that, again, then how did we change our architecture on an ongoing basis, right? Changed quite a bit. So it was more of an iterative way, but again, as I said, it's more left and right heavy, with QA, the quality assurance portion, taking majority of our time.
I think also the ethical use of AI, that's big, so we, because we're dealing in healthcare, we're really dealing with very sensitive, data, like the data that all these healthcare firms deal with is sensitive in nature, highly confidential, private information, and then you're trying to run LLMs on it. You just have to make sure you're using the outputs in an ethical fashion. So I think having a AI council with an organization like LA Care is planning to have an AI council, which would be chaired by our chief medical officer, and it'll be and the whole cabinet will be represented there. So having a board just to make sure you are keeping it human centered, you have transparency, and you're really striking a balance so that ethical use of AI, having a board just to manage that is also important.
So I'm seeing like 3 ways that organizations are approaching how they are adopting AI. There are certain organizations will say we have an AI division, they are the only people who will work on AI, right? And there's one way that people are doing. Others are saying we want to promote innovation, so anybody and everybody can work on it. And then there are some other organizations who is actually creating a platform and create a federated model where with appropriate guardrails, where people cannot drive down the cliff, but are able to use within the guardrail that they set across the organization, right? So that they are encouraging everyone to develop, but within the guardrails that is controlled by an AD. But there are 3 different ways that we have seen some of the clients that is approaching. I believe the third one will probably be the one that everyone will adopt over a period of time.
So with less than 2 minutes remaining, if I were to kind of request each one of you to kind of provide some closing thoughts around as we kind of go after this vision of transforming healthcare through AI, in your roles and your context, what are those potential big wins you see on the horizon? And not to say that you've already started implementing or testing, but what would you say would be maybe 1 or 2 successes which if we were to get there would provide very tangible impacts to cost of care, health equity, patient outcomes, and wellness?
Yeah, I would say the most important thing is to get all the stakeholders on the same page, right? Because there is a lot of news out there, a lot of material out there about AI. There is a lot of, you can say, dark side of AI, or people are scared with AI. So how do you get people on the same page that, okay, we are implementing AI in our organization. What does that mean, right? And how will it help us? How will it help our organization doing the same way, right? So for me, it's more about being the evangelist, being the educator, knowing both the domain and technology on educating all the stakeholders, including for us, it was mainly our board of directors. So I used to go present and show, okay, this is the ROI, 300% ROI after we implemented this, and they used to be like, wow, but what does that mean? So I had to do offline sessions with our board of directors to educate them on what exactly AI means and how it is. So I would say educating and bringing everyone on the same page is like the key to success. of any implementation of AI?
Yeah, along the same lines, I think educating, showing the value, right? And AI is nothing to be afraid of. That's how I see it. It's here to actually help us. It's going to augment human minds. So it's definitely a good thing to at least explore and not to be frightened and worried that it's going to take over our jobs. And I've heard that from folks like, especially the software developers. They feel they're threatened by AI, but AI is here to augment what human minds are doing, and I think we should welcome the offering, and again, data and privacy and security, these are like really important, security especially. So making sure your data is in a fairly good, is fairly clean, and data management rules, implement data governance to kind of lay out the foundation before you start talking about implementing LLMs on top of your own data. Because for healthcare, especially some of our firms, I'm not sure if we can use what is available in the public. It will be more running LLMs on our own data. Mm-hmm. So making sure your foundation is strong so you can scale up and adopt AI. Mm.
I think we're going to see ongoing enablement throughout our workforce within healthcare, where some of the jobs will, the productivity will increase. Some of the work will be eliminated and replaced by. Some of the work will continue, but it'll get better from an outcome perspective. Right. The one thing that I want us to not forget is that the patient satisfaction, the patient experience is extremely important. So whatever we're implementing to be more efficient, to be cheaper, to whatever, it also has to meet the patient where they're at. And let's not forget, these are often people on their worst day.
Right.
So today the technology is available to identify a personality trait. The social media can actually identify the personality trait of a person better than their spouse, right? And why don't we use that technologies to personalize the care management plan and make better experience for the patients or members, and improve adherence. If you just look at the medication adherence, is still at 50%, right? That's addressing that by another 25% itself is, we ask for cost of care. It reduces the cost of care and then also work towards improving the whole health of a person.
Thank you, Anand, for bringing us home with that thought about whole health, because that's what the panacea of what healthcare industry is all about. Thank you everyone for being on the panel and sharing your insights, and thank you audience for sticking with us through this late afternoon. We'll look to continue the discussion as we catch another coffee after a couple of sessions, and then and later tonight as we get into the reception. Thank you, everyone.
Thank you.